Cardiovascular diseases are still the #1 killer in the world. Despite all the efforts, despite all the technological developments that improve the way we treat cardiovascular disease, and we really have been good at treating cardiovascular disease, but we have not been good at preventing cardiovascular disease and on implementing what we know today about how to manage cardiovascular disease. And that's really a very important issue because it's really affecting the whole world. We have 18.6 million of people dying with cardiovascular disease, more than 300 million people with some form of cardiovascular disease. And knowing that about 80% of cardiovascular conditions can be prevented, it's really important that we develop strategies that can help us to implement prevention so we can reduce the burden of disease. We have a specific target, the Sustainable Development Goal 3.4, which will be to reduce by 1/3 premature mortality of cardiovascular disease by 2030. Unfortunately, only 14 countries are aligned with this target at the moment, which means there is a lot of work to do, and that's why it's so important that organizations such as the World Heart Federation, together with its members, its partners, can continue to provide this type of elements and this type of gatherings where together we look for solutions. The World Heart Summit is really one of the pinnacles of the World Heart Federation. It engages all our members, but also engages decision makers, policy makers. We also have been very much engaging some authorities like governments, like different players that really can make a difference in cardiovascular health. Key opinion leaders that really can help to promote our goals, to promote our mission for cardiovascular health for everyone. We really have an outstanding group of people intervening at the summit, from ministers, so government officials, companies, patient organizations, societies, foundations. So we have here the representation of the cardiovascular world and also the ones that we really want to target to help us to implement strategies that can help us to achieve our goal of reduce the burden of disease and improve cardiovascular health. What I would do if I would have this magic wand was to end with cardiovascular disease. We know that's not possible, but at least to have the possibility of giving access of people to have proper medical care. We still have huge problems and asymmetries in the world. So if I could have this one that would allow everybody to have access to what is the current innovation, what is the current methods that we have to treat disease, but also to have access to measures that we know some of them are not that difficult, so to improve the quality of healthy life for the population and to provide the sort of resources and the sort of things that can really make people happy, healthier lives free of disease.